This educational clinical video presentation is brought to you by the Department of Surgery of the Chinese General Hospital and Medical Center. Today, we will present thyroid cancer, its signs and symptoms, diagnostic procedures, and treatment. The thyroid gland is a butterfly-shaped organ at the base of your neck. It is an endocrine gland whose function is to release hormones that regulate metabolism for vital bodily functions. Thyroid nodules are an unusual lump or enlarged area in your thyroid gland. It may simply be reactive swollen tissue, an overgrowth of normal thyroid tissue, a collection of fluid known as cyst, or an abnormal growth termed as a tumor. These nodules may be benign. Benign nodules usually do not have the propensity to spread to other parts of the body. Majority of the thyroid nodules are usually benign. On the other hand, malignant or cancerous nodules have the capacity to spread and damage nearby tissues and organs. They spread to other parts of the body via blood or the lymphatic system. Thyroid nodules may be characterized as either solitary or multinodular as seen in our pictures. Most thyroid masses will produce local symptoms such as a mass in the frontal portion of the neck, pain, difficulty with swallowing and/or breathing, and may be associated with hoarseness or voice changes. Other symptoms may depend on your thyroid hormone levels. Hyperthyroidism or elevated thyroid hormonal levels will usually present with increased bodily functions such as weight loss, faster metabolism, palpitations, heat intolerance, anxiety, and feelings of constant irritability and nervousness. On the other hand, hypothyroidism or low thyroid hormonal levels will usually present with slower bodily functions, resulting in a decrease in heart rate, memory loss and forgetfulness, chronic fatigue, dry hair and skin, and weight gain. Risk factors for development of thyroid cancer will include the following: family history, age, gender, and radiation exposure, with women being more likely to develop thyroid nodules. Other risk factors include a family history of thyroid cancer, a nodule that is found to be hard or is stuck to a nearby structure, or is non-movable on palpation, male gender, age younger than 20 and older than 70, and history of radiation exposure. In order to diagnose thyroid cancer, laboratory examinations such as thyroid function test and ancillary procedures such as ultrasound and fine needle aspiration biopsy of a thyroid nodule may be employed. This is done to characterize the nodules and determine whether they are benign or malignant. Thyroid function test determines if the thyroid hormone circulating in the blood is within normal limits. Derangements of this hormone will usually result in hyper or hypothyroidism. The function of the thyroid is measured using the three parameters of T3, T4, and TSH to determine the overall result of hyper or hypothyroidism. Neck ultrasound is a painless method that uses high-frequency sound waves to provide an anatomical picture of the thyroid. The ultrasound allows the physician to characterize and visualize the nodules of the thyroid gland. Ultrasound-guided fine needle aspiration biopsy or FNAB may be performed on a suspicious thyroid nodule or enlarged lymph nodes in the thyroid gland. It is a procedure where a needle is guided using ultrasound to collect a sample from the suspicious nodules. Ultrasound is necessary to increase the accuracy of specimen collection to ensure that we are targeting the right nodules. Fine needle aspiration biopsy will allow physicians to determine whether the nodules have features of malignancy or not. The nodules are usually examined under the microscope, and these will show whether they have the features of malignancy such as papillary thyroid carcinoma or follicular carcinoma, or if they are benign in nature, such as colloid cysts. Treatment modalities will include medical and surgical treatment. For medical treatment, the aim is to return thyroid hormone levels to normal and to maintain these normal function. Thyroid hormone supplement and anti-thyroid drugs may be employed to maintain normal thyroid hormones whenever necessary. It is important to keep the patient at a euthyroid state in order to maximize healthiness and well-being for our thyroid patients. Surgical treatment is indicated in the following instances: for nodules that are cancerous or for those that are suspicious of cancer, for those associated with obstructive symptoms due to enlarged neck mass, and for patients who are presenting with compression symptoms such as difficulty of breathing and swallowing, and lastly, for cosmetic purposes. Operations to treat thyroid cancer include a total thyroidectomy, a thyroid lobectomy, which involves only removing one part of the lobe and the middle portion called the isthmus, and lymph node dissection for those with cancer spreading to the lymph nodes. Another option for treatment is a radioactive iodine, which is often used after thyroidectomy to destroy any remaining healthy thyroid tissue, as well as microscopic areas of thyroid cancer that was not removed during the procedure. It comes in the form of a capsule or pill that may be taken orally. It is primarily taken up by thyroid cells and thyroid cancer cells, so there is a very low risk of harming other cells in your body, hence an increase in specificity for the treatment. No matter what treatment you choose, it is important to consult with your healthcare specialist to determine what regimen is best for you. For more information about our services, please visit the Chinese General Hospital and Medical Center website at cghmc.com.ph.